Perfect. Thank you. All right. Good evening, everyone. Thank you for being here, especially during the time change. I know it's a little disorienting, but I'm glad we're all here today. So today I'm going to talk to you about traditional Chinese medicine. We're going to look at it through the lens of a couple different topics. And before I begin, I just want to invite you, as you are absorbing the information that I'm going to share with you today, I invite you to, instead of thinking of Chinese medicine as an alternative medicine, I invite you to think about it as a complementary medicine to what you guys are going to be doing. I know most of you are students, if not all of you. And as you work and you learn, you're probably going to hear about all these alternative methods. But one of the things that was really important about the school that Paulette and I went to for acupuncture was they were really emphasizing on this pluralism, how we can integrate ourselves and be a team of healers for our patients, not just Eastern medicine over here and Western medicine over there. So keep an open mind. I'm going to throw a lot of different concepts at you that maybe you've never heard of before. And if you have questions, that's perfectly normal. It was confusing to all of us at the beginning too. But I want to share with you what I'm passionate about, which is educating people about their health, because if we have more resources, we can make better decisions as individuals, and that's what we can do for our patients as well. So I teach the information in the way that I wish I could have learned it. So that's how I'm sharing it with you today. All right, so let's get started. First, let's start off with, well, who am I? What are my credentials? So I grew up in the Midwest. I went to school at the University of Minnesota to get my undergrad. Moved out to San Diego and got both a master's and a doctorate in Chinese medicine. I studied both in Thailand and in China doing internships. I offer acupuncture, Chinese herbology, different types of body work. One of the things I specialize in is Qinei Song, which is an ancient medical abdominal massage, and I'm going to talk about that later. I studied in Thailand with a Taoist master, and I specialize in digestive and emotional health because the two of them are related, and I'll show you more about that later as well. I teach courses. I have different workshops, both live and online. I have pre-recorded classes that I'm going to tell you about at the end, and I'm also a provider for CEU. So you can probably tell by the end of this that I love to teach. So I'm happy that you guys are here today to learn. All right, so traditional Chinese medicine, also called TCM, which I'll refer to it for the rest of the presentation, has evolved over thousands of years. And one of the things that I always tell my patients is, if it didn't work, why would they keep doing it, right? So that's why this medicine has been around, and a lot of the classical texts still apply to things that are happening today. Of course, there's variations and modifications as times change, but a lot of the very basic principles can still be applied to medicine today. We're going to talk about a lot of the different techniques, right? We have the acupuncture needles. The picture here is of fire cupping. We have other tools like washa, massage, herbal medicine, teas, tinctures, and this is a preventative medicine. So that's something else to keep in mind, is that this should be something that patients come to first to take care of a lot of the things that don't need to progress as they often do. I'm going to talk more about that later too. Let's start with the basics. So when we use Chinese medicine, we look at the body as a microcosm of the macrocosm. So before there was all the technology to look inside the body, the Chinese would meditate and connect to themselves and realize that we were a reflection of nature, right? And so in observing nature, they were able to apply those concepts to our bodies as well. A really good example of that is, why is pumpkin spice only popular in the fall? Because pumpkin is something that's only harvested at the fall time, right? So that's usually when we eat pumpkin. It's rare that you're gonna eat pumpkin in the spring because it's not appropriate. So that's just one of the examples of how we eat with the seasons, according to Chinese medicine, because we're connected to nature. And if we tune in and follow that alignment, then we can live happier, healthier lives. Another thing that we are going to talk about is the yin and the yang. These are the two opposing yet complementary forces, and disease can result from the imbalance between these two. I'm going to talk to you about the 5-element theory, which is the next level, where we have 5 different elements that associate with different organs. We want the alignment of those 5 elements as well. And if they're out of balance, then that's where disease can exist. And then we're going to talk a little bit about qi as well. It's the vital life force that goes through our body, and it comes from the foods that we eat, the herbs that we take, the breaths that we have, the exercise that we do or do not do. This is an essential part of our bodies as well, and I'll break that down for you so you can understand it a little bit. So let's start with the yin and the yang. So as you can see from this moving yin-yang symbol, they have this interdynamic play where one is always turning into another. A really good example is the sun moving through around the earth, right? So we have light that comes up, it gets bright, and then it turns dark, and light and bright, right? And it keeps going on that cycle, and it keeps happening in this pattern. And so that's the pattern that we apply to the body, is yin and the yang. You can see this long, extensive list where the yin is the feminine, the dark, the shade, the night, the moon, right? Cold, wet. And then the yang is the masculine, the light, the sun, the heat, the dryness, action. And so there's this play between the two that needs to happen for us to be in balance. And when they're out of balance, that's when sickness can show up. So then let's talk about qi. So qi is this idea of a very loose, inaccurate translation of energy, but that's what our Western minds can think of. You probably heard that. But it has many shapes and forms. We think about water, it can be a liquid, a solid, and a gas, and that's what qi can do. It can change its shape and form and density. And every action or non-action can affect the qi in our body, and we can change it with the actions that we take, with the foods that we eat. You know, if you're going to eat a pizza, you're going to feel a lot different than when you eat a salad, right? That is qi coming into your body and being, and you're having that, feeling that effect within your body by having those different meals. And the thing about qi is that it's neutral, and we can set our intention and give instructions to it, right? What I tell my patients is every time you eat a meal, if you can't answer the question that the food in front of you, is it medicine? If it's not medicine, then should you be putting it in your body? Because in Chinese medicine, we use a lot of food as therapy to help our patients as well. I'm going to talk about Qigong. You may have heard that term. It's very similar to Tai Chi. So Qi means energy loosely, and Gong means work or practice, right? So any kind of energy work, any kind of energy practice, that is what Qigong is. I also like to think about qi like a computer, lines of code, right? Somebody somewhere wrote lines of code that programmed the computer to be able to see my picture so you could see it in your home or wherever you're at right now. Somebody programmed that. But we don't see it. We don't see those lines of code. And that's how qi is in our body. We may not see it, we may not sense it, but it's happening at all times to make things possible. Another way that qi shows up, or the qigong I was talking about, is the first one is medical. That's one of the things I studied when I went to Thailand and studied with the Taoist master, was medical qigong. We're using practices that specifically heal the body. Secondly, you've probably heard of martial arts before, right? That's the self-defense, the discipline, right? These are different forms of fighting, if you will, but that's also a qigong. And then there's the spiritual qigong too, which are more the meditative, the self-reflective, being connected to nature, right? So we can see this qigong show up in different aspects of our lives. And so how do most people experience these health challenges in regards to their qi? Is emotions are a big one, right? Mental illness is something that's coming more and more into the forefront of the conversation worldwide, something that we've ignored for a long time. But the Taoists and the Chinese talked a lot about how emotions impact the health of our bodies. If people don't exercise or move their bodies, that can cause a lot of disharmony, lack or poor nutrition, having injuries, chronic illnesses, right? Lack of resources. These are how people can experience these health challenges. So then what do? We replenish the qi, we replenish our bodies by suggesting things such as nutrition, herbology, right? Acupuncture, exercise, you can read the list, meditation, qigong. Big one is cleaning up our thoughts. A lot of people's negative self-talk can impact how their bodies function as well. And we can manage the emotions and balance the organs as well. So now I'm going to talk about the 5-element theory. So this is a very brief overview, but it's this idea that we have elements that are associated with each of the organs. And we want this balance between the organs and their elements. And when they're out of alignment, that's a pattern of disharmony. Everything is based on patterns. That's basically what we are as acupuncturists, is recognizing that the body functions in patterns. And our job is to investigate and recognize what are the patterns of disharmony, what is out of alignment, and how can we tweak it back into alignment with the needles, with the herbs, with exercise, etc. So these organs have this interrelationship, and any pathological change can happen to these organs if they're out of balance. I have another chart here that breaks it down a little more for you. So we can see each of the elements also have different organs related to them, the taste related to them. One I always like to point out is salty. Do you ever have patients that like salty foods? It usually means that there's an imbalance in their water element, which is related to the kidneys and the bladder. So that's something that we can look for. And we have colors and sounds that are related to them, and the emotions as well. So just a little review. We talked about the theory of the yin and the yang, the 5 elements. We're going to talk about the treatment in a few minutes here. And again, I want to emphasize that this is a preventative medicine. We can do things to prevent patients from feeling worse, right? If you can get ahead of it, then you don't have to worry about those things, because what's the best kind of repair? It's the one you never have to have, right? Okay, so when we think about Chinese medicine, we divide it into 2 categories. It's both internal and external medicine. The external medicine is probably what you know most about, which is the body tools, the acupuncture, the cupping, the tuina, which is a massage. Gua sha is the tool we use. There's topical herbs that we can use, plasters, something called moxibustion. Maybe you've heard of that. It's an herb that we burn on the body. And then we have the internal medicine. That's where we use food as medicine, number 1. And then we can also use Chinese herbs, right? And that consists of things like roots, stems, twigs, mushrooms, leaves, berries, even insects. And a lot of this people can find in their kitchen as well. And I'm going to share some of those with you later on. So diving a little deeper, this external medicine, right? So if you don't know what acupuncture is, it's small needles that are applied to specific points along the pathways where the qi flows, called meridians. We can also use cupping, where we create that suction on the skin. You've probably seen those red marks on different people. Some celebrities are now showing up with those as well. And it helps bring blood flow to an area that might not otherwise have it. And then, of course, there's different types of massage. And perhaps you've learned how massage can circulate the blood, the lymph. It can relax the body. It can calm the mind. We also have things like the moxibustion, like I talked about. It's a dried herb from the mugwort family that's burned above or on the skin. We don't burn people, not on purpose, but it can also help strengthen the flow of qi and energy, especially if someone's cold. It can warm the channels, it can warm the organs. It's a really great tool that I like to use in the clinic as well. Tai Chi, similar to the Qigong, like we talked about earlier. This is breathing techniques, slow moving martial arts that can help get that lymphatic flow in the body. And then Qigong, again, it's very similar, promoting the flow of qi through the body. And there's both internal and external practices of that. And diving deep into the internal medicine, right? We talked about the Chinese herbs, and nuts, twigs, leaves, mushrooms, so on and so forth. And herbs in the kitchen. There are so many herbs that people use all the time in their kitchen. I'm sure if you go home today and open your kitchen cupboard, you're going to find some of these herbs in there. Turmeric, cinnamon, anise, peppercorn, right? Those are all really great things that you can have. And then food is medicine as well. Chinese cuisine is filled with herbs that are often integrated into the dishes. So it's a wonderful thing that you can use. And here is a brief and not exhaustive list of some of the things that we can treat with Chinese medicine, right? Mental, emotional, anxiety, depression, stress, insomnia, respiratory issues, that's been coming up a lot. Gastrointestinal issues, all kinds of things that happen in the gut, you name it, we can probably treat it. And musculoskeletal issues, right? Headaches, migraines, neuropathies, dizziness, frozen shoulder, sciatica, low back pain, right? So we can treat a lot of these things. So, you know, it's easy to say we'll treat anything, but you name it and we can, except for maybe a gunshot wound or a stab wound. I'll probably send my patient to the ER for that. All right, you get it, right? Chinese medicine can do a lot of things. Now that you guys have a little bit of a background, I want to share with you some concepts about Chinese medicine. But before we do that, are there any questions? I know I just threw a lot of information at you. You can either turn on your mic or if you want to put it in the chat box. All right, no worries. Save your questions for the end or type them in and Paulette will let me know. Moving on. So now I'm going to talk about Chinese medicine and how it works through the lens of these three topics. And I chose these three because these are probably the most common conversations that I have with my patients. They're either in pain, they have sleep issues, or their immunity is compromised in some way. And you know that these interact, right? If you have a patient in pain, probably not sleeping very well. And if someone's not sleeping very well, then that's probably affecting their immunity. Or vice versa. If they tend to be someone with a low immune system, then they probably have sleep issues, and sometimes that can cause pain as well. Right? So there's an interconnectedness with this, and we're going to look at each of these one by one. So the first thing is pain. And what do you do when you're in pain? Let's say you get up from your computer or your phone and you stub your toe. What are you going to do? After you curse, you're probably going to grab that spot that you hit and you're probably going to rub it around, right? What are you doing? You're trying to get circulation to the area. You're trying to move what just happened. So this is what we can do with the acupuncture needles. Now, I'm not saying send every patient with a stubbed toe into us, though it could be appropriate at times. But let's talk about how acupuncture can help your patients with pain. So we need to think about acupuncture not based on energy, but based on anatomy, right? This is a flesh and bone medicine. There's a lot of confusion, skepticism. I talked about that already. There's mistranslations about what qi means. It was inappropriately translated as energy, but it's the closest concept that we can understand as Westerners. But it underestimates and misrepresents the capabilities of Chinese medicine. So keeping that in mind, what acupuncture can do is improve the flow through the body, right? We need to nourish every single cell of the body. Number one, with oxygen, right? That's needed for producing the chemistry that drives the metabolism of most living things. We need to get the nutrients to all the different parts, right? So we need that to be moving as well. And then you need that blood flow, right? The blood brings the oxygen and the nutrients to all part of the body. Every single cell needs oxygen. And if the oxygen isn't getting there, then the cell isn't going to be able to do its job properly. So if we think about acupuncture as a cardiovascular medicine, then we can start to understand the concepts of how it can definitely benefit some of our patients, especially when we're talking about pain. So acupuncture treats the #1 cause of disease, which is blood stagnation. You guys know that if there is impaired blood flow in the body, if there's an obstruction somewhere, that area is going to malfunction. So that's what it's all about. When you step back and look at big picture, it is all about circulation. And that's what acupuncture can do. That's what Chinese medicine offers, is to help create circulation in the body. So here are some examples of those obstructions that we're talking about, right? A heart blockage, shortness of breath, fatigue, dizziness, those heart palpitations, muscle cramps, spasms, calf cramping, limited range of motion. Tech neck is a big one. We're going to be in business a long time with tech neck. And digestive issues, right? So constipation, gas, blowing, undigested food, right? How many people have crappy diets that come into your clinic, right? And that's an obstruction of the qi flow. So where is all the healing? It's in the blood, and that's what acupuncture can support, is the blood flow of the body, because the body cannot heal without proper blood flow. So here's a very simplified version, or explanation of the acupuncture process. So usually a patient will come in, we'll do an intake assessment. If necessary, we'll do palpation and examination, and then we select acupuncture points based on their Chinese medicine diagnosis, and we'll insert the needles. What happens when we insert the needles? The blood vessels dilate, a histamine response is activated in the body. Sometimes redness comes around the point. It's a foreign object. We are sticking into the body. So that body is going to show up and bring that histamine response. It's going to move the lymphatic system. And you're going to get a biochemical response that occurs in the CNS as well. And then the blood flows to the targeted areas of the body. And we usually let the patients relax for 15 or 20 minutes with the needles retained. Sometimes we'll do both the front and the back treatment, depending on what the patient needs. And there are studies that show that the benefits of acupuncture can last up to 30 days, if not longer. And I can say, in my experience, I've had patients, with 10 years of knee pain in one session, all their pain was gone after 10 years of suffering. And so that's pretty amazing to me. And that's just, my experience. But there's a lot more studies coming out that are showing that these long-term benefits of Chinese medicine and acupuncture can impact patients in a positive way. Another thing that acupuncture can do is engage and interact with the nervous system. So we're going to talk about each of these. So the mast cell, I talked about that histamine response, right? When the mast cells detect this foreign object being entered into the body, and it sends the healing capabilities of the body into that area that didn't otherwise have that happening. We also have the prostaglandins, right? They're stimulating that nerve fiber, which stimulates, goes up the spine into the midbrain, turning on the brain and making that connection. And then it also engages the natural painkillers. It signals your brain to release the opioid-like substance called enkephalin. Am I saying that right? Which is your body's natural painkiller, right? So these are just 3 things of all the other things that acupuncture can help with. So if your patients are in pain, suggest acupuncture, because this is a natural approach that's an alternative option instead of medication, right? Especially with the opioid issues that are happening right now. People have addictive behaviors. This is a nice alternative for those people. So just to review, acupuncture works by improving qi flow, the oxygen flowing through the body, the shui, which is the flow of blood in your body, the shui mai, which is the health of the blood vessels, the zongfu is what we refer to as the health of your organs, and the jingmai is the health of the nervous system. So in general, acupuncture works by bringing the body's natural healing abilities out so it can help itself, right? So now that we have a little bit of a background about all of that, are there any other questions? Otherwise, I'm going to move on. Type in the chat box or unmute yourself.
Hey, Dr. Romer. We have a question about whether or not the slides will be available after the...
Yes, I can put them in a PDF for you.
Thank you.
Hi, Doctor. First, people who have never experienced acupuncture, could you explain a little bit about how it feels?
Yes, absolutely. So if you've never experienced acupuncture, it can be intimidating, right? Because most of our experiences with needles are hypodermic needles, which are thick and hollow, usually because there's a fluid going in or out of there. But acupuncture needles are thin. They're as thin as hair, actually. And I think, gosh, I should have put the picture in here. You can fit like 42 acupuncture needles into the head of a hypodermic needle. That's how small it is. So it's really tiny. So the way that I describe it to my patients is if there's any sensation at all, it feels like a mosquito bite, right? You'll feel the mosquito bite you, but then it'll dissipate. So it's really light like that. But I'm not gonna lie and say that there aren't some points that are uncomfortable, especially if there's like acute inflammation or it's a muscle in spasm. There are definitely points that can be uncomfortable. Things more like toward the tips of the fingers or the tips of the feet, sometimes even on the head, that can be more tender, or if there's an area that's inflamed or irritated. But more likely than not, we're not going to choose those points on your first session. So we want people to feel comfortable, especially during that 15-20 minutes when you're laying there with the needles. Most patients are like, I don't even feel them. And that's what we want, is just for you to relax and not be uncomfortable. Every once in a while, we'll hit like a little capillary, and sometimes I'll have to adjust the needle, but usually not. Good question. Thank you. All right. I'm going to keep going on this presentation here. All right, now we're going to look at it through the lens of sleep. Whose sleep isn't messed up now with the time change? Okay, so we're going to talk about the power of restorative sleep. This is a really important thing, is people can definitely sleep, but that doesn't mean that they're getting good sleep, right? So quality sleep matters. So let's ask ourselves, do we have patients that have challenging sleep symptoms, such as they can't fall asleep, stay asleep, they wake up during the night? Do they take sleep medication? They've been on it for years. Have they done a sleep study, CPAP, right? Or do they have some kind of sleep disruption, right? They can't turn their mind off. They're stressed about work. They have animals, pets, a partner that keeps them awake. And we know for a fact that lack of sleep or poor quality sleep can be linked to things like inflammation, obesity, diabetes, depression, cognitive decline, a higher mortality risk, right? So this should be a priority in a lot of patients' lives. It can also have a notable impact on cognition. It can slow your reaction time, the consolidation of memories, that place keeping can be diminished. People can have false memories from not being able to sleep well. It can hinder that cognitive flexibility that we once had when we were younger, and it can alter your emotional information as well, which is super interesting. So let's talk about the anatomy of sleep. And we're going to first talk about it as Western medicine. Perhaps you guys have seen this chart, right? We know the stages of sleep. You're familiar with this. Stage 1 is that falling asleep. Stage 2 is when your heart rate changes, your body temperature drops. Stage 3 and 4 is that deep sleep, the muscles and tissues repair. And then ideal is that REM sleep, right? Where we're paralyzed and dreams begin. So now let's talk about it through Eastern medicine. So we're coming back to the yin and the yang. Remember that example? So we think about it in relation to the melatonin and the cortisol too, right? As it gets dark out, the cortisol drops and the melatonin rises. And as the melatonin rises, cortisol should disappear and we should sleep. And then as the sun comes out, the melatonin fades and the cortisol comes up, right? So on and so forth. Well, guess what? What happens if that cortisol is being released at midnight because you looked at that email that you shouldn't have looked at that late at night, right? So that's going to release that cortisol and you're going to get this disruption of the harmony of how that cortisol and melatonin should be interplaying with each other. So this is one of the things that we want to think about when we're thinking about sleep. And I'm going to give a lot of examples to help your patients out to help regulate that, because that's really important to have. But before we do that, we're going to take a look at this. This is so interesting and people really love looking at this. We have this circadian clock. So we talk about how there is a 2-hour period in a 24-hour day where the organ or the chi of the body is focused on one particular organ. And so based on this clock, we can look at the time and see which organ may be out of balance based on the time that people are waking up. So the example that I really like to give first is the liver. The liver is between 1 a.m. and 3 a.m. So we know that the liver detoxes things, it helps metabolizes. Well, if you ever went out drinking at night, for those of you who drink, what time is the last call? It's usually 1 or 2 a.m., right? And guess what happens at 1 or 2 a.m.? You get that second wind. You can have another drink, right? Why is that possible? Because that is the time of the liver where the metabolism of the toxins is able to be invigorated and you can get another blast of energy to be able to keep drinking through the night. Or we can look at the opposite time, which is the stomach time, which is between 7 and 9 a.m. Don't we have that phrase that breakfast is the most important meal of the day and it should happen sometime between 7 and 9 a.m.? Why? Because this is the time of the stomach. This is when the body's energy focuses on the stomach and digestion to prepare you for the day. So you can take a look at this chart on your own, and maybe that's something that you can ask your patients is, what time are you waking up? What time are you not able to fall asleep? And it's usually going to be one of these 2-hour periods that you're going to be able to be directed toward the organ that's out of balance based on the time that they say. So when you get my slides, you can take a look at this chart, keep it in your pocket, keep it on your phone, and you can start to assess your patients based on this time. So as you can see that there's 2 different ways to look at the sleep cycles, and there are different ways that we can help patients with all of this. So now I'm going to talk about 4 different topics in terms of the power of restorative sleep and what we can do about it.
Dr. Jess, we have a question
Sure.
on the chat. I have two questions actually. One is, what does the triple burner time refer to?
Yeah, good question. So the triple burner. Okay, so it's a
I know it's a hard one too.
it's a hard one because we don't have like a Western equivalent for it. The triple burner is considered 3 parts of the body, all in the torso. So we have the Sanjiao is the other name. So we have the 3 jiao. So the body and the organs are divided into 3 parts. So we have the upper, which is the heart and the lungs, which is thought of as like a mist, right? And then we have the middle burner, which is the stomach, spleen, liver, gallbladder, which is thought of as the muddy waters, which is like digestion, breaking things down, fermentation. And then we have the lower burner or the lower jiao, which is considered the drainage ditch, which is the intestines and the bladder. And so when you think about how I described those organs and the 3 sections of them, it comes down to temperature and water metabolism, right? So sometimes you can have that flipped. You can have patients where there's too much water in their lungs, right? And they're choking and they're got a lot of phlegm, right? That's because that water metabolism is out of balance. So the triple warmer is this idea, it's called an organ, but it's not an organ, it's all of the organs. So there's some theories that the triple burner is actually the thyroid, and there's other theories that the triple burner is actually the vagus nerve. So it depends who you ask and where you look. But this was, kind of the concept the Chinese had before they were able to really kind of have access to the anatomy of the body that we now have in modern times. So yeah, so it's a little, I hope that wasn't too convoluted, but it's a tough concept to grasp, but it is an organ, but all of the organs. So I hope that answered your question.
Yeah, I guess like when I was in practice, if I may just share my experience too, I consider the triple burner just like you said, like water metabolism. I think that's like the easiest way for me to think about it. But then also the other question was, it's a funny question, is that why a lot of people have bowel movements in the morning? They're looking at large intestine.
Yes, yep. So we actually have a name for that. Paulette's gonna laugh, I know. It's called cockscrow diarrhea, right? So when the sun rises around that like 5 to 7 a.m., the cock would crow and people would poop, right? So if your patient reported that they were pooping right at that like dawn hour, that's what we would call it. And then we would know that the large intestine was out of balance. So yes, exactly.
Thank you.
Good question. All right, cool. Thanks, guys, for asking. I appreciate that. All right, we were going to talk about digestion and sleep. Good segue. All right, so you probably heard about the gut-brain axis, right? And there's a lot to be said about that. And we're not going to dive into that too much, but I am just going to touch on it that there is more gut bacteria. The cells of the gut outnumber the cells of the body tenfold. And how do they communicate to each other? Through the vagus nerve. The vagus nerve is a super highway of information, right? It's the longest cranial nerve in the body, and that is the connection. Actually, I went to a UCSD talk some years back where they were doing studies where they were cutting the vagus nerve of mice to see if that disrupted the gut-brain connection. They were finding that the gut was totally messed up after they cut that vagus nerve on those mice. Anyway, it was really interesting. And then lastly, we have hormones that are released and produced in the gut as well, right? And guess what those hormones are? They regulate those cortisol levels. So if your digestion is off, that's going to impact sleep as well. That's going to impact the connection between the bacteria in the gut and what's going on in the brain. And I believe there's a study that's been showing that, is it Alzheimer's that can be detected early on? They're finding an enzyme in the gut that's a precursor to what they find in Alzheimer's in the brain, something like that. Oh man, I should have quoted that better. But I know I've seen that a few times. So super interesting stuff. All right, so sleep also can impact immunity, right? So if you have sleep loss, think about how this can impact the immune system. It can reduce those natural killer cells that we talked about earlier, which can increase things for cancer and viral infections. It can generate the production of cytokines, right? Which can increase the risk for cardiovascular disorders, and lack of sleep can decrease the production of antibodies, which increases the risk for infection. And now we're going to talk about sleep hygiene. So this is actually an excerpt from a book that I wrote that I'm going to tell you about later. But this is what I suggest to all my patients. First things first, having a night routine, doing the same thing every night to start to get your body cued into sleep. That's really important. Brushing your teeth at the same time every night, taking a bath, reading a book, right? Doing these steps every night so your body knows it's time to rest. Second thing is turning down the lights. Everyone leaves their lights on. When it gets dark and about an hour before you want to go to bed, turn on the little lamps, turn down the lights, right? That's what helps release the melatonin from your brain is darkness. So if you can start darkening the rooms before you have to go to bed, that can help. And the other thing, turning off those screens. Oh my goodness, this is always going to be a fight with my patients because everyone wants to look at their phone, watch TV, or be on their computer right before bed. And so the thing that I suggest to patients, because I know that's going to be hard for people to say no to, is blue light reflecting glasses, right? So that can be a really good thing to stop that blue light from coming into the eyes because blue light is stimulating. Right. There are a lot of phones now that have night mode. So I do suggest patients to do that as well. Dimming that screen can be helpful. And the other thing is giving yourself complete darkness, blackout drapes, unplugging those plugs. How many plugs come with like little lights that are glowing all night long, right? That can be disruptive as well. So think about it. We need complete darkness. What do you do if your computer glitches out and it can't function? You got to turn off the computer. You got to plug and unplug it, right? That's what we need to do as night, is turn off our brain by giving ourselves that complete darkness so we can totally be restored. So here are some sleep recommendations for you. Here are some herbs that I like to recommend. Swanzalren is the sour jujube seed that can be drank as a tea. Datsao is the Chinese date, same thing, it can be drunk as a tea. And then tart cherry juice. I like this one because my mother used to say, drink some tart cherry juice. And I just always thought it was like an old wives' tale until I started to research it. And it turns out there's traces of melatonin in tart cherry juice. So I suggest to my patients to keep some tart cherry juice in the fridge. And if they wake up in the middle of the night or they have trouble sleeping, just take a swig of that tart cherry juice and it should help them fall asleep. Maybe some of you are now interested in essential oils, right? The olfactory nerve is the only nerve that's exposed. All other nerves are blocked by something else or covered by another part of the body. So we can access the olfactory nerve with these essential oils. That's why they're really potent. Chamomile oil is sedative, can be a sedative and calms the nervous system. Ylang ylang can balance the right and the left sides of the brain. And lavender, of course, lavender, right, helps you fall asleep, gets a longer rest. It's a good one to have on hand. I always suggest some nightly add-ons too. Epsom salt baths can be really good, right? That magnesium, calcium can be helpful. If patients can't get out of their head, put cold water on their feet, right? So that's going to change the nervous system, right? Go to sympathetic into parasympathetic just by changing the temperature. And then CBD, we can't prescribe it. However, many patients ask about it, so I try to stay informed. I can't suggest that they do or do not do it, but we're in California and people are having the conversation, so it's good to be in the know. Patients want to be doing that. Taking a warm shower can help, of course. Drinking hot tea that's non-caffeinated. Doing meditations before bed, and then listening to the solfeggio frequencies could be another great thing. There's tons of YouTube videos where these sounds can help people get more restful sleep at night. And now let's talk about Chinese medicine for sleep. Here are some of the common things that I'll suggest. Acupuncture is something every night, or more often than not, I'll have patients come in and the night of their acupuncture session, they always report sleeping really well. Chinese herbal formulas can be really helpful as well. Massage can be a very good thing to help sleep. I'm going to talk about Qinei Song, which is something that I specialize in. And then acupressure. There's things I'm going to teach you that you can do with your patients to help them sleep as well. All right, so we already talked about acupuncture, so I'm not going to talk about that here. And now we're going to move on and talk about the Chinese herbal formulas. So Chinese herbal formulas date back thousands of years. They actually predate acupuncture. So it was herbal medicine was used first. And what's great about Chinese herbal medicine is we can customize it to the patient, base it on their constitution, base it on the symptoms. There's no one size fits all. There are different modes, or there are different ways that patients can take it, excuse me. They can have the raw version of it where they cook the raw herbs, but it's often not easy to get patients to comply to it. So it's one we don't do that much, even though it's cheapest. Decoction is where we pre-cook and it's just a liquid that patients drink. We can also do granular, which is one of the most common ones, which is just a powder that patients dissolve into water and they can drink it like a tea. But my favorite is tincture because it's just little droppers that you just drop under your tongue and that can be absorbed into the bloodstream pretty quickly. So I'm going to spotlight one of the formulas that we do use for sleep is called Swanzhou Rentong. And this one treats insomnia, nightmares, anxiety. It nourishes the liver, the heart, it helps calm the mind, can improve that quality of sleep. And it's really easy to modify for the patient's constitution. So it's one of the formulas I'll commonly combine with other ones to help patients sleep well at night. Next, I'm going to talk about Qinei Song for sleep. So what is Qinei Song? This is an ancient Chinese medical abdominal massage that investigates the causes of sickness, those negative emotions we talked about, stress, surgeries, toxins, poor food. This can be impacted in the gut. This is a method, a manual therapy that can be used to clear the blockages in the abdomen. And it's a complement to other healing modalities and body work too. So I often include it when I do full body massage as well as when I do acupuncture sessions. I'll often add this at the end. And I believe UCDAVIS is pretty close to San Francisco, right? There's a Qinei Song Institute in San Francisco. So I'm sure you could find a Qinei Song practitioner up your way, or if you're down in San Diego, look me up. I'd be happy to help you out and give you that experience. So this is what's really important, and this is why I nerd out on this, is the existence of the second brain. Have you guys heard this term? There's a second brain in our gut. And why is that? Because we have over 100 billion neurons in the enteric plexus of the gut. And these neurons learn. We can teach them different things. We can teach them how to behave. That's kind of a weird concept though, right? And did you know that Grey's Anatomy, that book, not the TV show, the book, just accepted the 79th organ? Does anyone know what it's called? Any guesses? It's the mesentery. So the mesentery just got accepted as the 79th organ, another organ added to the body. Okay, so as you see, the mesentery, I'll show you another picture in a second here. But when we look at the picture on the left, you can see where it all roots there right to the spine. This, in Chinese medicine, is what we have an acupuncture point here called the Ming Men, which translates to the door of life. This is between L2 and L3. And this acupuncture point is where the Chinese believe that the soul enters the body when we are born. And where is that? Right at the root of the mesentery, right? And what's opposite of that is our navel, right? And that's what we're connected to, our mothers, when we're in the womb, right? So my dad used to say, oh, it's those hippies contemplating their navel again. This is what they were talking about. This is what they were contemplating. This is where they were meditating on, was this area. It's so important. And so many people are stuck here because who touches your belly other than maybe your doctor? Maybe you guys are the ones touching people's bellies. Maybe your lover, or maybe your parents when you were a kid. But usually nobody touches your belly, but this is our engine. This is where all this stuff is happening. It's such an ignored part of the body. And it's so important, this work that can be done to help people out. So just taking a deeper dive, what's important about the mesentery is look at the arteries, the nerve plexus, the veins, the lymphatic ducts, right? Look at all of that information. It's information. That's what this is, going into the central nervous system, feeding the patient and what they're experiencing, right? This entire enteric nervous system. And so then with this concept, we can start to apply this idea that the organs have emotions related to them. And this is another class that I teach where I dive deep into all of this. But if we can start to pair the emotions that are associated with the organs, then when patients show up and they present with an emotion, it can guide you to which organ is out of balance. So if a patient comes in angry, that's going to be the liver. All right, cool. Now I know that the liver's out of balance, right? They're mad that you're like a couple minutes late. Great. Now I know it's the liver that's out of balance. And so that can help guide us to our diagnostic and using which tools we decide to do. So I'm going to show you a little video. This is me doing Chine song on a colleague of mine. So this is something called cat pause. And I just want you to watch how fluid this motion can be and how nourishing that can be to your patients. Think about how you're taught how to palpate. You know, you're digging in there, you're trying to feel the liver, trying to see if they have different things. But, you know, take a look at that and think about how this could break up stagnation, how it could relieve constipation, get blood flow in there. What would it feel like for patients to have someone to connect to them in this very simple, nourishing way through this massage? Something to think about. So why is Chine song important? For the emotional imbalances, for regulating those digestive issues. It can promote circulation and create a body relationship to patients. It's amazing how many patients say to me, what's in there? I don't even know what's happening. And I always have to say, I don't know. I haven't lived in your body. Why would I know? You tell me. Oh yeah, and we're still talking about sleep. So Chine song can help sleep. And now I'm going to show you a few acupressure. So acupressure is points that we're going to stimulate by pressing on acupuncture points. I'm just going to show you 4 quick points. So the first one is called pericardium 6. Now I can't see you guys' video on, but if you want to follow along, you could take your hand and you can go 3 finger widths below the wrist crease, right between those tendons. That is pericardium 6. If you've ever been to REI, they actually have wristbands that help for, this can decrease nausea, soothe anxiety, right? People who have car or motion sickness. This is a great point that you can massage. There's a point on the leg called spleen 6, which balances the hormones. So I'm not going to show you on my foot because that'd be really awkward right now. But you can see from the medial malleolus, same thing. It's 3 finger widths up from the bone. And there's usually a tender spot right in there on the inside of the ankle. That's a nice one that can balance hormones as well. And women, it tends to be tender. Why? Because this actually connects to the uterus. So a lot of women who are menstruating or have cramps, this is a great point to help relieve some of those symptoms as well. The next one is called large intestine 4. So it's located between the thumb and the forefinger. Perhaps you've heard of this one right here in the meat. This one is a great one to massage for headaches. It's actually an empirical point for anything in the neck and head. We can use this point right here. You can massage it on yourself or in your class. You're getting a migraine because your eyes are crossed and you can't take in any more information. But it can also help patients sleep at night. And then the last one is heart 7, which is located on the outside, the pinky side, right on the inside of the tendon. This is called the spirit gate. This can quiet the mind, quiet the heart. I've massaged this on patients who are having panic attacks. That could be a really helpful one as well. So again, Chinese medicine can do everything or many things. Hopefully you guys are still with me and you haven't fallen asleep yet. In the observation of time, I'm just going to get to the next part because I'm almost done with my presentation here. And I'll stay on afterward if people want to ask more questions at the end. So the last lens we're going to look at Chinese medicine through is immunity. So this is going to be a little denser material. So hopefully you guys aren't too tired and you're following along. All right, so the immune system is a bit more complex than what we've talked about so far. but we're working with qi again. So we have these three concepts of qi. And the Chinese were really into military, so I'm going to use these military terms, and this is how they described things. So if we think about our bodies as a castle, we want to protect the castle, right, from foreign invaders. So we have something called the Wei Qi. The Wei Qi is the soldiers, if you will, which are on the outside of the castle, right? So these are the guards that are preventing any foreign invaders. This is our outer defense mechanism that protects us from the outside world. And then we have our Yin Qi, which is the Qi that comes from the nutrition that we give, right? You can't just have those soldiers sitting out there all the time. You got to feed them, you got to let them rest, right? So that Yin Qi is the nourishment that we give our bodies. That's going to help create a place so we can support the defenses that we have. And then your Yuan Qi, it's a little harder to comprehend, but this is with the kidneys, which is right by that Ming Men. I'll show you on the next slide. But this mixes with our blood, mixes with the nourishment to help keep us fortified, right? So we need to have resources within the castle to be able to provide not only protection for the castle, but also be able to support those soldiers that are outside the castle. I hope that made sense. So let's break it down. So when we think about the Wei Qi, the first thing we think about in Chinese medicine is the lungs, right? So the lungs is literally bringing the outside world into our bodies. So this is our first line of defense. So if someone has weak lungs, then they're going to have a hard time not letting those foreign invaders in, right? Think about all the patients you might have come across with respiratory issues, how often they got sick, especially during this pandemic. It was very, we're all acutely aware of the importance of the lung health. So if you think about all the different practices, Qigong, meditation, yoga, what do they say? Come back to your breath. It's one of the most important things we can do is take care of our lungs, because that is our first line of defense. And then the stomach and spleen, which is related to the Yin Qi we were talking about, nourishment, right? What's the second thing we do? We put in our mouths, we put food in our mouths. Thanks, Paulette, for showing us all. The Yin Qi, this is how we nourish our bodies and keep our bodies strong, by putting the proper fuel into our bodies, right? Again, if you have someone eating a pizza versus someone eating a salad, you're going to have very different effects on the body and the quality of how the body functions and works and what the cells can do. So what we use as that food can nourish and improve the cells and the tissues to defend against those foreign invaders. And lastly, the kidneys. So the kidneys are your DNA, folks, right? So think about that Ming Men I showed you where the mesentery was connecting. What's on either side of that? Your kidneys. So in Chinese medicine, your kidneys are thought of, we call it your Jing or your essence, but it's your DNA, really. It's the yin from your mother, the yang from your father, right? The sperm and the egg, they come together and they form you. And that is stored in the kidneys, according to Chinese medicine. We call that Yuan Qi. So you don't want to just have the yin and the yang from your mother and father. You also want to nourish that for the foods that you eat, the exercises that you do, right? So it's this whole system and combination of things that need to work together in order for your body to have proper immunity. All right, so we have, for immune support, I would suggest similar things to what we suggested before, right? So you can see that there's a bunch of diverse topics that and conditions that Chinese medicine would treat. Again, I'd suggest acupuncture for immunity, Chinese herbal formulas, the Qinei Song can help immunity, and there's acupressure as well. So I'm not going to go over each of these again, but I am going to share some of the things that you can do at home and in the clinic. And I know that we're heading toward the end of time, so if you need to jump off, that's okay. Thanks for joining me. But I'm going to keep going. I just got a couple more slides here to show you guys. So the first thing, herbal therapy again. So here are some single herbs that are really good for immunity that you can suggest to your patients. Ginseng boosts energy, right? Fatigue is a lot of things that are often an issue that shows up with people that have immune issues. Astragalus, this is another one that regenerates tissues of the body and the brain. This is a great one to help that Wei Qi specifically. And then turmeric, it's anti-inflammatory. You can find it in your cupboard as well, right? And did you know that turmeric You can increase its potency, I believe, by 2,000%, the article said, if you combine it with black pepper, which is really interesting. So be careful about those supplements out there. If it doesn't have black pepper, you're not getting the what are they called? The pharmacokinetic benefits of the combination of those two. Food therapy, I haven't talked that much about it, but I hope you guys are getting a lot of nutrition classes these days, but simple things that patients can add to their diet to boost their immune system, right? Like blueberries are antioxidant, walnuts have those omegas, coconut oil is anti-inflammatory, right? There's a countless list of things that you can use, and that's a whole nother class. But here are just a few. And then acupressure, right? So we talked about Heart 7. This can help with the sleep. We talked about how sleep is important for immunity. We talked about Li4, right? That's also a good one for any kind of neck or shoulder pain. And then Yin Tong. This is another one that can help any sinus congestion. It's right between the eyebrows right here. It's actually related to the pituitary gland, right? We can stimulate that point either by massaging it ourselves or putting an acupuncture needle in there. Here are some other resources for you. A formula called Yuping Feng Song. We call it the Jade Windscreen. This is a great one, especially for patients who get sick, especially with the weather change. This can be a great one for some patients to take as well. Fire cider is something our pharmacist made, which if you haven't heard of it, it's like vinegar and garlic and jalapeno, and it's like all these warm herbs that just help boost the defense of the body. And then colloidal silver is another great one. It's a broad spectrum antibiotic that can support the immune system as well. And then lastly, this is the book that I wrote with a colleague of mine called Herbs Immunity Health. So we wrote this in response to the pandemic. We were repeating ourselves and all these suggestions, many of the things that we talked about. And we're like, why is there no resource for patients of what they can do at home, how they can help themselves? Because the conversations that was on the news and the media was just about how many deaths and what was happening and all these horrible things, but no one was talking about the positive things that we could engage our patients in being participants in their health to help themselves. So anyway, we wrote this book. It's available on Amazon, both Kindle and a printed version. And I'm just going to share a couple quick pages with you here. The most notable thing is we have a section at the back called What to Do When. So patients can look up their symptoms and then they can have some at-home remedies that they can use. And I'm just briefly going to go over these. So herbal suggestions for fever, cough, and sore throat. This is one of the things we talk about. And by the way, back in the day, if anyone had any of these symptoms, I would always tell them to come in immediately. I would treat these symptoms without blinking an eye because acupuncture is really good at helping people break their fevers, relieve their cough, get rid of their sore throat within hours, if not a day. So COVID's been really hard because we haven't been able to treat people like we were before. But things for fever, like mint tea can be really good. Elderberry, could be a good one to help cough as well, or honey and lemon is a good one. And then loquat is one of our herbs that comes in a honey syrup that can help soothe that sore throat. If there's sinus congestion, using a humidifier, some of those essential oils we talked about. And last, on the bottom, it says the neti pot, and a study just came out that showed that people who got COVID and used a neti pot decreased the chance that they had to go to the hospital. So if you clear out those sinus passages, that can really be helpful. Fatigue is another one that's really common. Drinking electrolytes, using a heat pack, getting good rest. And then we already talked about the lungs. You can like tap on the lungs, do what we call depotement, stimulate the lungs, get that phlegm out of there. That can help improve symptoms as well. And then we're coming down to the end. I know we're almost done here. So the book that I told you about, Herbs Immunity Health, and I wrote a couple other books. So these are ebooks, and I'm going to put a link in the chat box for you guys. These are free for you guys. So with another colleague, I wrote something called Biohacking Brain Fog, because we found that our patients, the #1 symptom people were having was brain fog. So we wrote a whole, I believe it's like 40-page ebook about what you can do for brain fog. We also wrote one on depression and anxiety, because that's like another thing that's coming up for a lot of people. We have 6 herbs to boost your immunity. And then I have online meditations as well. I'm available to do telehealth or by email. And, keep me in mind and reach out with questions. If you have patients with digestive issues, sleep disruption, body pain, here's my contact info. I'll put the links in for the books that I mentioned in the chat box, and hopefully they'll come with whatever PDF gets sent to you as well. So please reach out, don't hesitate. That's all I got for you guys today, just a couple minutes over. Thank you so much for listening. I really appreciate all of your time, and you guys are doing good work being at UCDAVIS and learning medicine. So thank you so much.
Any final questions from anyone?
I just wanted to add something. Thank you so much for all the information. I think this is really just so enlightening, and also just shows, just how we can use the nature around us. And unfortunately, you mentioned that maybe you were taking a lot of nutrition classes, but unfortunately, a lot of these kind of basic things that you would think like, oh, my doctor will know like what I'm supposed to eat to make me feel good, or what foods are medicine, but we don't really learn that indirectly. I took a lifestyle medicine course this last summer, and that was a little bit helpful, but not in the core classes. So this is super helpful, and I'm hoping to learn more information through your book. So I just want to say thank you so much.
Thank you. I appreciate that feedback.
Yeah, and if I could just echo what Millie said, just thank you for your time, Dr. Romer. It is really fascinating information, and for me, like, I love how the emphasis is on preventative care, and I plan to be a primary care physician in the future, and I see a lot of like really applicable information here, like with the acupressure and the abdominal massage. Like I can see how could this be implemented and have truly like integrative care. So it's exciting.
Excellent. Wonderful. Thank you.
Sorry, Paulette, will you be sharing the PDF of this along with like the link for the book to us, please?
Yes, absolutely.
Thank you so much. Thank you for putting this together.
Yeah, thank you.
Of course. Thank you, everyone. I will just give a couple more minutes if anyone else has questions. But if not, thank you so much for joining.
All right. Thank you all for being here today. I know you're very busy and you're all studying hard. I appreciate all of your time.
Okay, stop recording.